Hi, Arthur. Hi, Melanie.
Hello.
Good to see you last week.
It was a great conference.
Oh, thank you.
Great job.
I guess we're still a minute before 1:30, so we'll give it a little more time to see if you can join us.
Emily, I have 1:30 and Miranda is coming in now from the waiting room. And I believe that's got the waiting room cleared. So
Okay,
I'll turn it over to you.
perfect. Well, thanks very much, and good afternoon, everyone. I know we're getting very close to the holidays, so thank you for taking time to join us today for our final Consumer TAC meeting of 2024. It's hard to believe the year is over at this point, and nearly so. Why don't we get started with introductions? I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health, and I chair the Consumer TAC. And I'll hand it off to our other TAC members to introduce themselves: Arthur, Melanie, Brenda, and Miranda, if you want to do it in that order.
He's Arthur Campbell Jr. He is working in E D P representing. And he's representing PNA. Thank you.
Glad to have you on here, Arthur. Good to see you.
My name's Melanie Tyner Wilson, and I'm very honored to serve on this TAC. I think it's a very important work happens with this group. I'm here representing the ARC of Kentucky, the ARC of Central Kentucky, and the Autism Society of the Bluegrass. So thank you very much for the opportunity.
Thanks for being here, Melanie. And then Brenda and Miranda.
Hi, everyone. I'm Brenda Menino, and I am representing AARP.
Good afternoon, everyone. I am Miranda Brown. I'm a connector, and I'm representing Kentucky Equal Justice Center.
Good to see everyone. We do have a quorum, so we can do business and vote today. The first item on our agenda after a quorum is to approve minutes from our last meeting. Has everyone had a chance to look at the transcript?
Yes.
Any questions or anything that we need to discuss? All right. I'll ask for a motion to approve those minutes.
I make a motion to approve the meeting minutes from the previous meeting, November.
Thank you. And a second from Arthur. Thank you. All in favor, say aye.
Aye.
Any opposed? All right. Motion carries. The minutes are adopted. We can move on to old business. We always start by asking about the status of a few data requests. The first is how many Kentuckians are currently covered under traditional, expanded, emergency, time-limited, Medicaid, and presumptive eligibility.
Yes, hello, this is Jordan from DMS Eligibility and Enrollment, and I can go through the numbers and I'll post them in the chat as well, per usual. So for presumptive eligibility, we currently have 1,391 individuals receiving presumptive eligibility Medicaid. For the emergency time limited Medicaid, we have 319 in receipt of that coverage. For traditional fee-for-service members, we have 150,998. For expanded Medicaid, we have 1,306,502 for a total enrollment of 1,457,500 individuals. And posting this information in the chat now.
Thanks, Jordan. Has that increased
Absolutely.
slightly since last month or the last time we had a meeting?
So it's sitting around the same. It looks like our total last month was 1,458,000. So it's maybe like 1,000 have dropped out.
That's helpful. Thank you.
It's fairly similar to last month's total, yes.
Any questions about that? All right. And then our next data request is around Kentuckians receiving 1915 C waiver services, both those receiving and those on the waiting list.
Hello, it's Leslie. So it looks like we've got about 32,047 active right now are receiving services, and we've got about 13,687 unduplicated on the waiting list. So we've been trying to break that out a little bit more. We've got many members who are on more than one waiting list, or on a waiting list and in another waiver actually receiving services. So I know that's kind of confusing. We've got 1,745 that are on more than one list, and we've got 5,202 that are receiving services in one waiver but on a waiting list for another. The 3 waiting lists broken out right now is the home and community-based waiver, which is 2,544, the Michelle P. waiver, which is 9,365, and supports for community living, that is 3,523.
Thank you, Leslie.
Yes, ma'am.
Any questions about that? It's good. It's really helpful when you tell us about the waiting list, who's on another waiver already or who's receiving Medicaid services. I think that's a really
Yeah, last time I checked, it was
an easier way to understand.
39. It's 39 or 40% last time I checked are actually on 2 lists or receiving services somewhere else. So
Yeah, provides some good context.
Arthur wanna know if she breaks them down, when she breaks them down, can she send it to him?
absolutely.
Yeah, if you could email that to us, that would be fantastic. Thank you. All right. The next item we have here is our child eligibility enrollment and renewals. I know that the current plan, or at least last we heard, was to start renewals for children mid-year next year in 2025. Has anything changed there?
Hi, it's Veronica Judy Cecil with Medicaid, and we did receive official approval from CMS, from the Centers for Medicare and Medicaid Services, to continue our automatic extension of children. So when a child right now through June of 2025 comes up for renewal, we're automatically extending them for the 12-month. They get continuous coverage for that 12 months as well. However, CMS was very clear that starting with renewals in July 2025, that we will have to begin doing redeterminations before we grant that 12 months continuous coverage. So now that we've got that officially in writing, we are working on a plan to communicate that, make sure folks understand, because just like, unwinding where there was a 3-year period of not having to do anything, we want to make sure that, especially these are our kids, we want to make sure that the families understand that they're going to have to go through a redetermination. And so it's going to be very important for them to respond. We're going to do a lot of messaging around the fact that children eligibility has a higher federal poverty level limit, so just making sure folks understand that. So go ahead and send it in and let us make that determination as to whether or not they're eligible. So we're right now kind of talking about that and how to message that, and we'll probably start that campaign really early next year.
Okay. Yeah, that's good to know. And I think having schools involved in that campaign will be really helpful, especially with the work you're doing on school Medicaid now, but
Yes.
Friskies and school staff.
Yes.
A couple of questions. When you
Okay.
said that between now and June of 2025, when you do renewals, so you are already doing some redeterminations?
Oh, no. No, right now, children.
They're just
we-
enrolling. They're not being redetermined. They're just enrolling and
That's right.
getting
Yeah,
12 months of continuous eligibility.
that's correct. Yeah.
Okay.
Yeah.
All right. And then,
Emily, this is Melanie. Can I ask a question before
yeah,
you move on?
absolutely. Sure.
Miss Judy or Veronica, do you mind to share the final approved waiver application, either in the chat or just somewhere, so we can have an opportunity to be able to review it?
Sure. And it's just approval of our continuing flexibility. It's just a letter from CMS, but we'll send that
Oh,
to
okay.
the TAC or emails, and then we'll post it on the Consumer Rights TAC webpage since you all have requested it, and so people can go back and look at it.
Oh, thank you so much.
Yeah, we're happy to do that.
That would be great. I'm glad to hear that you finally got approval.
Me too.
No longer waiting on that. That's good. My question, oh, yes. So one of the things that we've, already kind of seen come up with some children's coverage is issues around residency. Is there anything that you've identified with some of those cases that could help us to prevent kids from being disenrolled for residency when they are still eligible? Is it just a matter of documentation, or is there something else going on, or?
I saw her when that cat was about to attack her.
Oh, let's see. Yeah, if folks could please, thank you, mute. We have received a couple, well, so first let me say, we did a review of renewals and found a couple of kids that, or individuals that it shows an out of state, but that's only because the parent or guardian is out of state, but the child is in state. And the difficulty is that, we can't catch that if that nuance isn't somehow reflected in the case. It really honestly can only be identified, through that we're kind of doing that regular look to see anytime it's a kid getting disenrolled, we verify the reason to make sure that it's a legitimate reason. So, they're really, and not to put Jordan on the spot, but, I don't know of any other way for us to identify those cases unless somebody brings it forward to us and it's a case by case situation.
Mhm.
Yeah, especially during like our transition activities with the MCOs, we were looking really closely at that and saw that there were some discrepancies in the head of household address versus what may be the children's actual address. And the only way we have to correct that is to do a manual review, try to make outreach as best as we can. CMS has provided some guidelines as to what constitutes appropriate outreach attempts. It's at least 2 attempts, different times of day, 2 different days, in addition to sending correspondence to the address we do have on file, which if it's not the right one, ultimately it ends up in us receiving the returned mail. So we try our best to make outreach and manually correct those when we see them.
Well, and I can imagine that this is not uncommon, that, when some parents are moving out of state and the child is living with either another parent or caregiver relative. I wonder if part of the messaging campaign could be what to do if you're not getting the notice and you're the caregiver, how to make a call to check on that case, because it could just be that the caregiver doesn't realize that, the address on file is the other parent.
I mean, I think we're open to some thinking through how we can try to overcome the cases that this does impact. As Jordan mentioned, as part of the Anthem transition, we identified a bunch of out of state, and rather than going, right to disenrollment, we went and contacted those individuals. We tried to reach them so that we could verify their address, and because we don't want to inappropriately disenroll anybody, obviously. And it underscores the importance of keeping your address up to date and accurate, so that we can contact folks when we need to. Certainly happy to think through what kind of campaign we could do, or messaging around that particular issue.
Yeah.
If the, I have another question, sorry. If
No,
the
of course,
child,
go ahead.
if the child's in kinship care, so maybe residing with another member of the family, is that something that you would automatically be aware of?
If Jordan, if you're updating, so if somebody updates their address and kinship, we do have an integrated system.
Okay.
I think it might update Medicaid as well, but Jordan, do you know for certain?
Yes. So where we have that integrated system, we have two different kind of address fields. We have the head of household address, and then we have the member individual level address. And so as long as in that head of household's case that it's indicated all of those household members reside at that address, it updates for everyone in the case, including those children that are in the kinship care program. And it would, if their Medicaid was for some reason on a separate case, it would update in that case as well. So that individual address that's picked up from the most recent, if we received a new address today, it would have today's date. It would pick up that most recent address. It would attach it to that individual and carry over to any additional cases they may have.
Okay, thank you.
Yeah, I would just caution that would only be for the families that are formally in the kinship system.
Yeah.
So just
Oh,
keep
good
that in mind,
point.
Melanie. Yeah,
That's a really
any
great
families
point.
that are more informally caring for kids wouldn't necessarily be in the system that way. But it's good to know that you have that system integration. Any other questions about child eligibility, enrollment, and renewals? All right, our next item here is the home and community-based service waivers, the federal final rules, and the rate study.
Okay, I think I'm going to go over these. So, good news. All 6 1915C home and community-based waivers were submitted to CMS and approved. 5 of them were on the 12th and 1 was on the 13th. So, they were all approved last week. So, good news. We're currently working on drafting emergency regulations, and making system modifications to reflect the changes. The rates will be effective January 1. Although some of the changes may take longer. So we're working through that as quickly as we can, Emily. Let's see, as far as the federal final rules, DMS has obtained a contractor. It's Health Tech with a subcontract to Mercer, and they are our vendor to navigate through DMS and our sister agencies through the federal final rules. So more to come on that. We're just really starting to get into that.
What was the name of that contractor again?
Health Tech with a subcontract to Mercer.
Okay, thanks.
And as far as the rate study goes, it was submitted along with the waiver amendments, and it has been posted to our website. We're currently drafting communication and preparing the rates to be published, and hoping to have the first of 2 letters probably coming out Friday. Don't hold me to that, but we're really going to try Friday of this week.
That's great. Thank you.
Yes, ma'am.
And once the rate study is published, what is the next
Arthur
step?
has a question.
Okay, Arthur, why don't we go ahead with your question, Arthur?
Can she email? Can she email him?
Yeah. Yeah. Yeah.
Tell?
Yes.
Oh, can she email him telling him what what each worker? Waiver. Each waiver. Oh, right. Each waiver rate is. He said, can you email him, telling him of what each waiver rate is?
Yeah, let me get back with staff and I'll try to get that sent out through Aaron or Kelly.
He said, thank you.
Uh-huh.
Thanks. And Leslie, I don't know if you heard my question, but what are
Oh,
the
sorry.
next steps after the rate study is published?
So right now, the biggest thing that we're trying to work on is to get the e-regs established and communication out. And I'm leaving out something. Sorry, Emily, I just blanked. Oh, system changes. That's the biggest. So as soon as we get the systems changes, we don't want to not have the systems in place and not be correct and then have to do up any cleanup work. So that system is really the piece that we're working on right now.
Okay, that sounds good. Thanks. Any other questions related to the waivers or the rate study?
And this is for traditional providers as opposed to people doing PDS. Is that correct?
Alicia, are you on? That included. Did it include sorry.
Mute. So the waiver applications included rates for everything.
Yeah.
There are some rates where even if you are providing participant directed services, those rates can be increased. Of course, that is up to the participant, not the employee. But if a participant who's receiving those services believes that their employee needs an increased pay rate, they are able to meet with the case manager, fill out the new, contract forms and all of that to increase the rate. That doesn't affect all services, but there are some services. And for example, I know just one off the top of my head, I think is like respite. So we will, once we can get that letter out, like Leslie said, we have a couple of different letters. The first one will be a short little letter with the payments, what those base rates are. And then there are gonna have to be some changes made in MWMA by the case managers for a few of those services. And we are working on a letter to address those changes that will need to be made. And we're gonna get that out as soon as possible.
Thank you.
You're welcome.
The first one that you receive is probably going to be more like a little memo to you all. So don't expect like 2 formal letters or anything like that. Sorry, I shouldn't have said 2 letters. 2 communications. How about that?
That
Or
sounds,
more.
did you have a follow-up question, Melanie?
No, but thank you.
I did have one other question. Thinking about some of the recent legislative committee meetings that I've, just been watching, and the budget reports or the kind of budget preview that DMS has given to legislators, I'm assuming that the increased rates are already kind of included, baked into the budget that is being presented to legislators now. Is that right? Okay. And I'll just say that there's been a lot of conversation in those meetings. Legislators are asking questions about, why rates are, or why the Medicaid budget more broadly is growing, where that growth is coming from. We know some of it is the rate increases for home and community-based services, which is a good thing. And we want to make sure that, sometimes increased cost is seen as something bad, but we sometimes need to remind people what that means. It means that providers are getting paid more for the services that they're providing, which means we have more providers who are willing to participate. And that means more services are going to be going to the people who need them. And the other source of growth, as I understand it, is hospitals. They're getting the average commercial right now, so they're getting more reimbursement. And that means that, they're able to cover more costs and provide more services. So keep their doors open, all the things that we need in our communities to make sure people have access to care. So just be aware that those questions are being asked. And when you have the opportunity, we need to just be educating people about why there's that increased cost. So the next item we have here on the agenda is the Kentucky initiatives on permanent supportive housing. Any new activities?
I think I'm gonna handle that too, Emily. Ann Holland, who is the DBH lead for the 1915 SMI
I'm
SPA.
sorry.
No,
The
it's she.
1959, but you went right back there, so thank you.
So, yeah, Anne, it wasn't available today, so I just told her I would go over a couple of bullet points here and confirmed with her that they were okay, and then I'll go back to the other one. So Kentucky's 1915 State Plan Home and Community-Based Waiver Services, we're calling that the RISE initiative, offering 10 support services to individuals with serious mental illness or co-occurring serious mental illness and SUD. The 10 services offered are assistive technology, case management in-home, independent living supports, medication management, planned respite for caregivers, supervised residential care, supported education, supported employment, tenancy supports, and transportation. Currently is continued productive work with CMS on an approval for our state plan application, and we work with them every week on trying to ensure that we can do this as quickly as possible. We are ensuring that individuals needing the institutional level of care are eligible for the 1915 value of a functional assessment for eligibility and person-centered planning for individualized support plans as well. DMS and DBH, of course, are working in partnership and working closely together every week to draft regulations for individuals, provider participation. We're working on that, covered services and reimbursements. We are still working towards a 7/1/25 hopeful onboarding and certification of providers and beginning to conduct assessments for referrals for individuals. So even though we've still got a lot to do, we're really, really hoping that we can still start implementing, not full implementation, but by July the 1st of 2025.
All right.
And
That sounds good. Are you expecting approval within the next few weeks?
Not
If you
sure.
have an
We're
implementation,
very close.
knowing that
Yeah,
you already have an
we
implementation.
possibly could, Emily. CMS is working as hard as we can to finish things up before January. So it's been extremely quick turnaround times for us. So we've been working very hard on those as well. One thing I would mention too is the SMI 1115 that is the companion to this 1915 SMI. And I don't know, so I'm going to announce it right now. We were just recently last week approved for all components of Team Kentucky and all components that go with it. So we have had an unbelievable last couple of weeks. I think we have submitted maybe 14 total RAIs, maybe 15, 6 waiver amendments, and then the 1115s, which that's multiples. And I can come back and talk about that later. It's continuing the SUD, it's continuing the Team Kentucky, the former foster care. It's part of a Senate Bill 90 for residential recovery support services with SUD under Senate Bill 90. It's also that recuperative care pilot that will now be under a health-related social needs arm. The Kentucky's going to have an arm for health-related social needs. It's all very, very exciting. So we were also given approval to move forward with the implementation plan for reentry, even though we haven't received an approval. They said to go ahead and move forward. We were close enough to go ahead. So as you're aware, we've got lots of moving parts right now. Good things that are going on, and I can come back and talk about this later too, is Reentry also included a component of Consolidated Appropriations Act for the youth. And we also have a second authority, which is, the Congress that has also enacted a piece of the Consolidated Appropriations Act as well. So they're not exactly aligning with each other, but Kentucky plans to go live January with what we call our Kentucky implementation using existing resources. So we are looking at one youth development center and hopefully all prisons that children of a certain age and certain charges may be incarcerated in prisons as well. So that's very exciting and more to come on that.
Yeah.
I have a couple questions.
Yeah, I think you had one more question on here too. Sorry, I didn't mean to. Oh, we continue to work with the we call it the Housing Continuum of Care organizations and with our sister agencies to address permanent housing, supported housing needs of Kentucky. And that's I think you've asked me before about our work with KHC. We're working on state plan amendments and preparing for system alignments and implementations for services. The Learning Collaborative has also included work towards securing grant funding, securing vouchers, and seeking out training opportunities to learn more about funding opportunities. We did receive, I think it's 25, I have to look, it's 25 or 35, let's just say 25 allocations for HUD vouchers recently from our collaboration with them for Money Follows the Person, which we've not received any of those for years. And so we're very excited to be partnering and be able to take advantage of things like that again. Okay, now you go ahead if I've missed something.
Are you talking to me?
Oh, Emily, I'm sorry. Who is
No,
talking?
Brenda,
I'm so
go
sorry.
ahead with your
Brenda, I
question.
apologize, Brenda. Go ahead.
For those of us who don't work in this field every day, I am not familiar with some of the acronyms. So what is the 1915 SPA? What does that stand for?
It's a 1915I, and it's a flexibility that CMS allows us to apply for. It is a state plan amendment. That's what SPA stands for. So although it's home and community based and looks very much like a 1915C waiver that you're probably more familiar with, like SCL, Michelle P., the two ABI waivers here in Kentucky. It looks similar to that, but it's actually a state plan amendment allowing us to incorporate multiple opportunities into one. I always think I as all inclusive, but that's not exactly what it stands for.
And what does SMI stand for?
A serious mental illness.
And you had mentioned something about 10 support services.
Mm-hmm.
Is there somewhere you could list those so we could
Mm-hmm.
see them?
Yeah, and we should be posting this fairly soon because CMS, we would have this actually already posted when we went through public comment, what services were going to be submitted to CMS. And it's assistive technology, but I can send this
Could
to
you put that in the chat?
Sure. Yes, I sure can.
Thank you.
And this is,
Go ahead, Melanie.
I'm sorry. And I didn't want to question, if you have somebody that has an SMI, significant mental illness, but also has cognitive challenges, are they, when you look at supportive housing, are they incorporated into what's being made available?
Melanie, right now, the way that waiver is specifically written for individuals with serious mental illness diagnosis or a co-occurring with serious mental illness and SUD, which is substance use.
Okay.
So this is the first waiver or state plan amendment we've had like this. We've got, multiple other ones that are related to individuals with developmental disabilities. So I'm just going to share that. I don't know what the future might hold, but this particular one was written specifically through legislation for this particular initiative.
So this would most likely be individuals that function like a 70 or above in regards to cognitive functioning. Would that be safe to say? Okay,
Yes.
thank you.
Melanie, I'll ask about that though. But I think I'm correct when I'm telling you that.
Okay, well, thank you.
Yeah, these have been good questions, and it reminded me that while I think these, the state plan amendment and the waiver proposal application, whatever we call it, have been posted before, it might be good if you could just send them in an email to our group again, in case anybody's interested in reading through some of the details.
When you were talking, Dr. Hoffman, about the 25 allocations for head vouchers, this is a lot of stuff that I don't follow very closely, and I don't really. Can you explain what that means?
Good question.
I just muted myself. I did the opposite of what I meant to do. So Kentucky has vouchers for housing where the rent rate can be matched by the federal government as part of the rent. And you have to apply for HUD vouchers for individuals. And so we're all kind of always competing. Certain programs are competing for those same HUD vouchers that the state might have. So this year we were able to get 25 allocated to Kentucky Money Follows the Person to move people out in HUD housing apartments or houses coming out from institutionalization. So we've not had that for years, so it was a blessing.
So you mean that's 25 allocations specifically for the Medicaid agency as opposed to
They're
other agencies?
vouchers for members who are members in the Money Follows the Person program. I don't know if you all heard about Money Follows the Person. Has been around. We call it Kentucky Transitions sometimes. It's been around for many, many years, and it's going strong. We're one of the few states that have. I mean, it's a very shining program, and if you want us to come back sometime, I could have Robert Duff's the manager for that. They're doing good work. And we also leave, you've probably heard me say this, we reserve slots in the waivers for those folks that are coming out of those institutional settings through Money Follows the Person. So we offer additional opportunities for those members to come back into the community and be successful.
Places like Hazelwood and Oakwood and
or it could be a nursing facility. It could be a nursing facility.
Okay.
Yeah, if other people are interested, I can add that presentation to our next agenda about Money Follows the Person, where DMS could come and share more details.
Oh.
Okay. Thank you. Any other questions before we move on? All right. Our next item here is school Medicaid grant implementation. I know that there's been a lot of work on the needs assessment, and just wondering, what the status is there and any future opportunities for stakeholder engagement.
Hi, good afternoon. It's Erica Jones. So part of our grant application was including a preliminary needs assessment, and what Kentucky is doing now is a final needs assessment. Input on that included a parent survey that went out via Friskies, some of our different community partners, and also on social media. And we also had 4 focus groups that met at the end of October, early November. And from all of those findings, synthesizing all of that, we'll have a final needs assessment and infrastructure assessment for Kentucky. Is due to the Center for Medicaid Services in January. So we should have that available for public viewing in January as well. Oh, and then the second part, future opportunities for stakeholder engagement. After we do our needs assessment, the next part would be an implementation plan. So once we've determined where those needs are, how are we going to fix those? And so there would be many opportunities for stakeholder engagement at that point. We haven't determined how that's going to look just yet, if that would be more focus groups or if it's going to be more surveys, just not sure what that's going to look like, but we can share the implementation plan, some of that, the results of that the next time we meet.
Yeah, having those results would be great. Let me just make a note to include that on the next agenda.
Will those opportunities for stakeholder engagement, will those be listed, with dates and times and locations?
Yes, we can make all of that available. We haven't got to that point yet because we've been focused on the needs assessment. But once we get into the implementation planning, definitely we'll share all of that information.
That's great. Thank you.
You're
Yeah,
welcome.
thanks, Erica. This actually reminded me that parent survey, and I appreciate having the opportunity to share it out. But we were kind of, I think, scrambling at the last minute to make sure that everyone had received it. So one thing that has occurred to me with that experience, and then also recently with the reentry forum that happened, was that earlier this week? Last week, I guess. And then the MAC and BAC meetings. There are just a number of things. Oh, an EMT survey that went out recently was only posted on the Department of Transportation's website, and we hadn't seen it anywhere else. I know you have so many things going on at DMS, and I appreciate the amount of stakeholder engagement you're trying to, bring in, but it feels like it's inconsistent in like where that information is sometimes being shared. And so I think I'll make a recommendation later on just to, make sure that these things are being emailed out to stakeholder, email distribution lists and also posted on social media, but, more consistently so, because I think we're always finding different people are telling me that they've seen something and then we're trying to get it out, but it's often a last minute scramble. So, not to say that you all are, I don't think that's something that's part of intended by any means, just it happens whenever there are lots of different projects going on and different people taking the lead on them. Any questions related to school Medicaid? And then the next item here is actually another set of surveys that had gone out. This was months ago now. I can't remember exactly when this began, to survey Medicaid members and stakeholders following the renewal process. I think Helen had shared that there were going to be some published findings, and I didn't know if those were already prepared, if those are ready for public view, or if they're still a work in progress.
It's Veronica again. They are still a work in progress. We've prepared something both on the survey results, and we have been working on some really great information to put out on how Kentucky fared in the unwinding of renewal and the renewals, both nationally and with surrounding states. So we've been working on those. They're just kind of going through the process that it has to go through to get it approved, so we can then put them out publicly. So they're just, on the scale of priorities, they kind of have to get sort of pushed back sometimes. And I will say, so we've been working on a draft because we are interested in implementing permanently a regular survey for folks who go through a renewal, both those who are renewed and those who are disenrolled. So we've drafted something. We've not been able to put it back on the table and take a look. And then, we certainly want to share it and get some feedback on that before we launch it. We certainly appreciate that. So hope maybe next month, possibly, or the month after, have that ready for a review so we can get your all's input on it. It would be helpful to us.
Yeah, absolutely. I think that would be a great project for the consumer TAC. Well, thank you for that update. Any questions related to those surveys? Okay, and our final old business item is the access to services form. And I believe that it is live because I saw a version of it last week. But it would still be good to hear a little bit more about how you're planning to promote it and any sort of next steps.
We get on camera. Hi, I'm Angie Parker. Yes, it is live, and we haven't done any formal education about it yet. We are doing what you would call a soft opening. It is on our Division of Quality and Population Health webpage. There are some challenges with the actual form in that you have to have a PDF in order for it to send automatically. So we are continuing to look into that. And I know, Emily, you had asked, but via the unwinding, and there was a way that it was done, but I believe that was done through Connect, which is a different system and how those are set up. So that's
I was
part of the
thinking of the
problem.
presumptive eligibility enrollment form that was up during the early, on in the pandemic. When people didn't have to log in, but it was a web form that you could fill out and it wasn't a PDF. It was just a simple web page. But I thought that it was really simple to use. And I'm sure, Miranda, that you had opportunity to use it in assisting folks too.
Yes, it was just a public web page that you typed information in and click submit.
But I don't remember that it was necessarily on Connect. You didn't have to go through the Connect portal. I know that for certain because there was no login.
No, at least not early on in 2020. We didn't use Connect for that. No.
Yeah.
We'll continue to investigate that. But,
Okay.
and if you want me to, I can show everybody the form and where it is.
Yeah, that'd be great if you could
Kelly,
even drop a
if you can
link in the chat.
give me access.
I will. Give me just.
Thank you, ma'am.
You are welcome. Let me stop sharing. Okay, you should be good now.
Okay, here is the page. Whereas I mentioned Division of Quality and Population Health and the member access. I have this over here. It describes it. And then we have both English and Spanish. And here is the form. Basically, you must have Adobe Reader. So we did provide some information on how to potentially get Adobe and then submit it here, or you can submit it via email or mail it. Of course, we know if you mail it, it's going to take longer, and we would prefer that not be the form that is taken regarding this. But even with the soft opening, we did have someone who found it and submit a form via email. I believe they must have had Adobe because that's the way it came across. But we've only had one so far. But like I said, we haven't done any public announcement yet, per se. And we will be, showing this to the MCOs, and the one that came through was regarding trying to find an eating disorder provider. And it was addressed with the MCO, and they were able to find the member somewhere to go. So.
Oh, that's great. That's exactly what we need this form to do. Well, thank you for that update. I think having a link to this is good. And while ultimately I'd like to see it, just on a more simple web page so that we don't have that PDF sort of barrier for folks. I think we should go ahead and try to share this out to our various networks. I think a lot of it's going to, rest on community stakeholders and advocates, and also providers, making sure that patients are aware that this form is out there, so that they can complete it when they're having trouble getting a provider.
Well, we were kind of looking at doing like the formal launch in the first of the year,
Okay.
with Anthem going away. We didn't want to confuse those things and as well.
Yeah.
So
Well, and if you
probably
have
do the formal education on that. It will definitely be the 1st of January.
That sounds good. And if there's any specific communications that you're planning to put out that you could share, that would be great to see.
And Rachel Rarick could just posted a comment. She's the one who helped did put this all out on our website, and it's on the member page as well.
Oh, great. Well, thank you, Rachel.
So I was thinking back, and when we worked on that one pager about network adequacy, can you remind me where people can find that information, the general information about network adequacy? Is that also on the member page?
Oh, yeah, now that's been a while. I don't know. We've had
Yeah,
some
it could be
changes to the
something that could be
website,
linked
so.
here. I think you're right though, Miranda, that we should have them,
Mhm.
together because that's kind of a supporting document, obviously, to explain a little bit more about what network adequacy requirements are.
I was thinking anywhere that the one appears, the information of the other should appear or a link to the other should appear. Yeah. Now that we have.
A good point.
Rachel, take that back and we'll look for it. That's been a while. Yeah, that's a good idea, Miranda. Thank you.
All right. Anything else related to that form?
I don't
We
have
appreciate
anything.
your work on it and we're excited to start sharing it out. Our next item here, hopefully you don't hear that yard work happening behind me. I'm also home with a sick kid who's run in here a couple of times, but so far he's been really behaving himself. The next item we have here is new business, and the first item is beneficiary advisory council. We discussed this briefly on our last call, but I wanted to get a little bit more into some of the details and also really think through what our recommendations are for a beneficiary advisory council, how it should operate, how it should, who should be members of the council and how that process for identifying members and appointing them should work. And then our relationship as a consumer TAC to the back, because obviously there's a lot of overlap there. But I believe that Veronica has a few slides that she's going to walk through. Hopefully everyone knows that Medicaid has had one forum already. It just happened yesterday on the MAC and back. And I wasn't able to do that because I had a conflict, but tomorrow I believe is the other forum. So if you weren't able to join yesterday's, try to make it to tomorrow's.
Okay, can you all see, should be the slide? Okay. Thank you, Emily, for that plug. And it is true. So we're hosting 2 virtual forums. One was yesterday, the other is tomorrow. And I have the very last slide has information about that, as well as the survey that we are conducting in conjunction with the forums. So today, I know the agenda wants to focus on the Beneficiary Advisory Council and appreciate that. It's brand new to Kentucky, and so really, we're starting from scratch. But you kind of have to talk in concert with what's happening and the changes to the Medicaid Advisory Committee as well, because they will go hand in hand. The federal changes, the final rule requirements around this really is contemplating that they work together. And in fact, it says they expect the BAC, the Beneficiary Advisory Council, to meet before the Medicaid Advisory Committee meets, so that the BAC is prepared, the members that that will be on the MAC are prepared and can, interact and engage in those meetings. So we can't, as we talked yesterday with a lot of folks that kind of want to focus on what they want the MAC to look like, they have to understand its impact to the BAC, because there will be one. And in particular, there is a certain percentage of the MAC that has to come from the BAC. So the membership has to be made up by 2027, has to be made up by 25% of the members of the BAC. So when as you're talking and as we've discussed, like how many people should be on the MAC, you have to remember that up to 25% of those by 2027 have to be BAC members. So you're already, identifying people that have to be part of that MAC. So I just put together a couple of slides to help, I think, facilitate maybe the conversation today, especially if you all can't make it to the forum tomorrow. And there are just some key components that we really kind of feel like folks need to focus on. And one is the membership. So, the BAC is only former and current Medicaid members and Medicaid family members and caregivers, either paid or unpaid. So very, prescriptive or limiting in who can serve on that back, which we think is very appropriate. We're very we're very excited to have a back dedicated to those with lived experience, both directly as a Medicaid member, but also, as equally important as family members who help and support that member. How they should be selected. The selection of the back, they do have to be selected by the commissioner, but that selection process has a lot of discretion at the state level on what that looks like. The term, the federal law does not dictate what the term of the membership is. So it could be 2 years, it could be 4 years, it could be 6 years. The current MAC term is every 4 years. But this is another kind of really important thing to know, is that a member cannot serve back-to-back terms. So right now under the MAC, somebody could serve for like 30 years, but on the back and the new MAC, you will not be allowed to serve consecutive terms. You could be reappointed on down the road. There's nothing wrong with that, but you can't serve back to back. The frequency of the meeting. So, this is also, I think, up for discussion. If you're going to ask the back, these beneficiaries, to meet at a certain frequency, understand that some of those are going to have to also meet on the MAC at a certain frequency. And so we have to really take that into consideration when we're setting that meeting schedule. And then the format. So the federal law does allow some of the meetings to be private meetings of the back. This is, brand new. So, trying to figure out, should all the meetings be private? Should some be public? Kind of what that looks like. So I kind of prompted some questions to help maybe facilitate conversations. But Emily, I certainly, the other thing I really want to emphasize, this isn't about us, right? The agency, we could certainly tell you what we think, but we don't want it to be about that. We really want all of our external partners, our members, our families, our advocates, our community-based organizations, and our providers to be, this is your chance to create this. And so it's not about what we think, it's about what you think. And so we're really trying to focus on that. There is no idea, too small or unimportant. They are all equally important to us. Any feedback that we can get, we're really grateful for it. So I will stop talking. I do have one, after this, I would like to show the one last slide, which gives information about tomorrow's forum and the survey that you all can access. And then we'll also post it in the chat.
Perfect. Yeah, thank you. And this, I think, was really helpful just to kind of set those expectations and what the opportunity is here. So I appreciate that. I've given this quite a bit of thought. I had a couple of questions that I think need to just to give us some more context here. In terms of the terms, you can't have those consecutive terms, but we do have discretion here in Kentucky to say, is it a 2 or a 3-year term, or whatever the case may be?
That's correct.
Right. Okay. And then as far as the timeline goes, I knew I could look back and try to find this, but I thought I'd ask you instead. When would the back start meeting on, if the 10% is July 9th, are we saying June or even before June?
We probably would anticipate the first meeting to occur in July, after July 9th. So yeah, we have to have it established by July 9th. And so, and I think what's really important too, and you all, the members of the TAC know this, we really try to work with the members of the committee to set the meeting date. So we really we'd like to get the members selected and then talk with them about what's the best, day and time for those members. So we've not set it yet. We anticipate doing that once the committee is formed.
That makes sense. Any questions for Veronica? I'd love to hear people's initial thoughts on this, in terms of membership and in terms of, the terms and the size of the back.
I have a question, like as far as your sharing of interest for serving, do you share your resume? Do you what's the appropriate way to share with the powers that be that you're interested in serving?
So that has not been established, Melanie. That's part of what we're asking people to give us their input on. What does that selection process look like? Is it applications? Is it certain organizations nominating folks? Right now, I can tell you the way that most TACs and the MAC work are their organizations that point the membership. For the MAC, they all have to be approved by the governor, and so that'll have to go away because it's the commissioner based on federal law who will select. But so it's kind of wide open on feedback on that.
So my thoughts on it, I think we should have a combination approach. Especially if, and this is kind of jumping ahead, but with the consumer TAC really overlapping with the back, I don't know that it makes sense for us to continue operating separately. And my initial thought was for the organizations that currently make up the consumer TAC and that are in statute as far as nominating the members of the consumer TAC, that we could include those same organizations in the statute creating the back, but also provide additional positions, additional seats that could be, open application and nomination form. And I think that we could potentially, I'd like to recommend that the consumer TAC work with DMS on creating that form, what the information, we'd be asking, what questions, to identify somebody's interest, but also their expertise. Are they personally a Medicaid member, have been, a former Medicaid member? Are they a family member, caregiver? Identifying also maybe disability status. We talked about people who are limited English proficient and maybe speak another language. I think LGBTQ could be an area where we'd want to make sure there's representation. We could just think through some of those particular types of lived experience and make sure that there's at least an attempt to identify people with that lived experience through the process, to have a good balance. And then another thought of mine is that we should really make sure that there is a formal sort of policy on both accessibility and accommodations. I know there's some language on the website right now that was added because in collaboration with the consumer TAC, because this is an issue that we raised a few years ago. But as we recruit people to participate, I think that accommodations have to be kind of a front and center part of that conversation. And rather than just saying like, you can request accommodations and, it'll be determined on a case-by-case basis. I think there just needs to be a little bit more emphasis there. And then that, of course, including language access, but also personal assistance, the other kinds of things that we've talked about in the past. Arthur, did you have something you wanted to add there?
He said he want to thank you for what he just said. We need something in writing.
Yeah.
He said thank you.
Yeah, and as part of the recruitment materials, I think, I think that would be really nice to have some recruitment materials to go along with whatever the form may be. And so that people understand, what is the role, what's being asked of me, what's the opportunity here? And then just logistically too, I think compensation is going to be important for people's time. I know that generally the state isn't, I think I understand that you all feel prohibited from paying people for their time in that way, but I don't know if there's been if CMS has given you any guidance on that.
There has been some guidance on it, and we're checking around. Also, some states already have a back. In our Dr. Hoffman mentioned we've got a consultant, Health Tech Solutions, and Mercer helping us with this. They've done a lot of research about best practices. CMS is kind of churning out new guidance every day to try to help states as they navigate this too. But it does say. In the final rule, it discusses the fact that if we pay, it is income. So it counts as income. But we could not the incidental, so travel, the travel reimbursement does not, but if we actually pay for someone to attend, that is considered income. But that's a question we were asking other states on how they're navigating that. And we are still waiting some more information from CMS.
Giving people the option, I think, yeah, it makes sense, but certainly you don't want to put people in a position where they could become ineligible because they're being paid. So yeah, I do understand that is a little bit of a difficult position for certain people to be in. Arthur, did you have something? Oh, Melanie, sorry. I was looking at different boxes.
I'm sorry.
Go ahead, Melanie.
Oh, is there a requirement that the meeting be in person versus virtual?
Have no requirements right now. So really we have none. So we're really trying to think through, and hear from folks like what works best for you. I know virtual has allowed so much more participation from folks, but that's not always the easiest to navigate. And we recognize that. And there was some conversation about that on the forum yesterday about, not everyone is able to navigate that. So making sure that if it is virtual, there are supports for the members on the back on accessing that.
Yeah, I think it would make a lot of sense for the members ultimately to decide if they want it to be a virtual or hybrid meeting with in-person. I think it probably makes sense to always have a virtual option, but I think to give members the opportunity to decide if they want an in-person option as well. Arthur, did you have another question or comment?
Yeah. I don't know.
You say he don't know
If
if he
will be that
you want to get paid. He don't know if he wants to get paid for his time. But but here's someone like him. Have to. He say he has someone like him who have to have an aid. An aid and a driver. And someone to translate. They have to have
fine.
Someone,
I'm fine.
sometime,
Yeah.
kind,
I'm
kind of. They have to have some kind of.
fine.
They have to have some kind of money to support. To support. To support the pay of the aide and the doctor and the driver. Sorry, that's one thing. And another thing, if we organize, if we organize this, there are three. There are three parties. Oh, sorry. There are three. B. O. Oh, there are three bodies of people, and we are talking about and we are talking about over 160 people on on all over the bodies. No. Do you know what he mean?
Are you talking about, Arthur, there are other committees that have lots of people on it as well? Is that what you're talking about?
Yeah.
Yeah.
Right now.
Right now, Mac has 25, and there are 17.
Yeah, technical advisory committees. Yeah. Yeah.
Hello.
Veronica, you're all too aware of how many.
This is
And there's about over 100. There about over 100. There's about over 100 already. And we are going to have another group
Mhm.
of people.
Yep.
Yeah.
Well, and
That's
to your- oh, sorry. Go ahead, Mark.
well, yeah, I was just gonna say it, and that's why we can't really talk about this as the back itself. Like we do have the 17 tax, and thank you for bringing that up, Arthur. And then we'll have the MAC, and we don't know what that size of that committee is going to be yet. You know, we're taking that feedback in.
Right.
And so we are concerned about, especially members, because we have members across various TACs. We have members on the MAC, and and then we're going to add the back, and so we are a little concerned about really just being candid about it, about trying to support all those happening. And, we already see a lot of the same or similar agenda items across tax, some of the tax, not all of them, but some of the tax. And so we're really trying to just be open and thoughtful about what does the structure in Kentucky, what does it look like? We're the only state in the country that has 17 technical advisory committees. All other states have a MAC with subcommittees.
Yeah.
So, we're the only state that has that form of structure.
Veronica, I was curious to know if you are still considering, or if you are considering going to some sort of subcommittee structure as part of this, like just part of the move toward the MAC and back changes, also revisiting the current TAC structure and finding ways to create, I would assume, subcommittees for things like, payment claims kinds of issues, more for on the, sort of services side, that kind of thing. And then of course the consumer piece of it.
Right. Yeah, we do in the forums, we are prompting the consideration of a subcommittee type format. So we're soliciting feedback on that
Okay.
as well, just to see what people think, because other states, and again, our consultant has been doing a lot of research about best practices, because what we want is engagement, and we want people at the table working together, and we understand people don't want to lose their voice, and that's not the goal. If other states have managed to figure it out, we're hoping that we can too, to try to make sure that members, providers, all have a seat at the table and have a way to interact, with each other and with us, to develop the program. And so, we're prompting that conversation and consideration as part of it.
I gotta ask something.
Hello.
If
Please.
if we want to
Stay away.
do
Away.
away, if we want to do away
Yeah.
with TAC,
The consumer TAC.
Yeah.
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 do we have to go to REP? REP. I'm not getting that word. Who makes laws? The registrars. What was the question again? If we have to change the talk, if we want to change the talk, if we want to do away with the talk, he's asking if you guys have to talk to the lawmakers.
The legislators. Yeah, this would require statutory change.
That's
so
correct.
My understanding is that there is going to be a bill in this upcoming session to create the BAC and then to make changes to the MAC more broadly and some of the tax potentially. Is that right?
Correct. That's correct. Yeah.
Yeah. So you're right on track, Arthur.
Yeah.
I think too that, it makes sense to me that you're exploring a committee structure, and it it does feel like it's gotten kind of unwieldy at this point with as many taxes you've got. But so are you saying that like you're revisiting even the size and the current appointments to the MAC, that 25 that is currently there could also change. It could be a different makeup in the future. So we shouldn't think of like 25% of 25 and think of that as like the back membership.
That's right. And you know, I think the member voice on the MAC is very important. So we're actually very excited that at least 25% of it is going to have to be, you know, from members or family members or caregivers or caregivers. So but yes, that's correct. I mean, you know, and what we're soliciting feedback on right now is what does the MAC look like? What is the size of the MAC? Just like we're asking the questions about the back. You know, what makes sense for the size of the MAC. And that's also something, again, the research we're doing in other states about how big theirs are and, you know, what's worked really great for them. That doesn't mean it's going to work great for us, but we're just trying to learn those lessons and, you know, bring some of that back to this is our opportunity to restructure. And what does that look like?
Right. Other thoughts? The one thing we haven't talked about yet, oh, sorry.
No. Just if I could just, the survey's going to be, if people could fill it out, it'll be helpful, especially because we're focused on the back today, but there's a lot that could change for the MAC as well, the Medicaid Advisory Council. So really, you know, taking the time to think about and providing us feedback about, you know, what do you all think that should look like? I mean, you know, is it 25? Is it 30? I doubt it's going to get smaller, but you know, and then who should be represented on it would be helpful. And you know, if you do have suggestions of going to the committee structure, what should those committees really focus on? You know, a lot of it has been eligibility and payment and equity are some examples.
Yeah. Quality, I think, should be another one. But so the survey, we can put all of our recommendations in the survey. I mean, I feel like we can also decide as a TAC today to make some recommendations, but I don't think we can make, you know, as many recommendations as we might all, you know, we're all still processing. I did want to bring up a couple other things quickly. So staff support, I feel like we see even with some of the questions that we've had today, which were really good questions about some of the acronyms, but also some of the, you know, what is a state plan amendment or a waiver? This money follows a person. There's just, Medicaid is an incredibly complicated program. Eligibility is complicated, all the different types of services, the population served. And I think that, it would be good to have somebody who could provide some more one-on-one sort of technical assistance to individuals, maybe have, you know, provide some of that background in between meetings so that somebody feels a little bit more comfortable with whatever the topics are on the agenda. And the other thing, and so, you know, that's not the way that our current TACs operate. I've had various conversations with TAC members here and there, but I've even been told that because we have public meetings that we're not really supposed to be having conversations or doing any sort of business separate from these meetings that are public and recorded and, you know, transcribed. And so I also think that keeping the discretion of how the meetings, whether they're public or not, is important for the back. I would hope that the back would want to have a certain number of public meetings every year, but to be able to also meet whenever they need to just do some education, do some meeting preparation, you know, put together an agenda, ask questions. I don't think that those should have to be, you know, governed by open meeting laws. That would be my other main recommendation.
one more question before
Hey,
we go home?
Yeah, go ahead, Arthur.
He wanted to know, can anyone get on a Zoom and listen on the meeting? If they can, do they have to do anything to join themselves or to join the meeting?
So Arthur, we are asking for registration for these. But they are being recorded and they will be posted, so you can go watch it at at any time, and then you can then submit the survey, after listening to it, if that'll be helpful.
I,
You
I,
you have a
yeah,
you have a BCH. Yes, you. Supervisor. Here's a HBC supervisor who wants to who wants to listen in it.
Right.
Does she have to register too?
If they're not in the room with you, yeah, they'll have to register to be able to access it. And I can put the link, I can email it to you, Arthur, if that's helpful. Or if you can give us the name and email address, we can send it.
It's about the problem is they don't want an agency that they work for to know that she's doing, that she's in the meeting.
Oh, okay. I gotcha.
I assume people can register with a personal email address and
Oh, absolutely. Yeah. And
you don't have to be part of an agency to participate.
And you don't have to show your name. So you don't have to show your name when you log in. You can put anonymous on there. Yeah.
No need to have your camera on.
Yeah, there's no cameras.
That will help. That will help them.
Yeah, absolutely.
Thank you.
Yeah, so I'll put in the chat the link, but if you just go to the DMS main webpage, the links are on there, and so you can go there and find them, and then we will be posting both recordings. We'll post the PowerPoint presentation that's being delivered there. We've created a one-page document so people don't have to go through the PowerPoint to understand what's happening and what maybe they need to be thinking about. And so we'll be posting that, but we do hope that you all take advantage and do provide us some feedback. It would be extremely helpful to us.
Thank you, Veronica. Yeah, definitely tune in if you can and take the survey. Either way.
I did note that in our last meeting, we were able to make one recommendation regarding the back, and then we had started another recommendation, but we weren't able to completely ratify it as a group because Arthur had to leave. And that was a recommendation about considering literacy and materials for the back members to be able to fully participate, for diverse back members to be able to fully participate.
Yeah. That's a good reminder. Thank you, Miranda. And we can consider that recommendation today, or people can choose to put that in the survey. Anything else related to this before we move on to the language access discussion? Well, I guess I do want to ask, having had this discussion now and understanding sort of the role the back is going to play and the fact that, we're we're adding a council that is going to be very similar to the consumer TAC. Does everybody feel comfortable with what I suggested earlier about having the consumer TAC organizations be kind of included as part of the back, but then also have additional positions, seats for additional back members that would be filled through some sort of nominating application process?
Yes.
Okay. And I don't know if everyone has, would be eligible to continue participating, all of the individuals who are currently serving right now on the consumer TAC. So just keep in mind, that it may end up being the organization nominating someone else, or in some cases, it could be the same person, depending on your relationship to Medicaid. Okay, I did want to kind of establish some clarity around that because I think that decision has to be made to move forward. And then we can probably put that into a formal recommendation along with anything else that people would like to see. Our next item here is language access presentation on just data related to, we've talked a lot about Medicaid members who are deaf, hard of hearing, speech impaired, and nonverbal, but we don't necessarily know how many people that entails, and just exactly, what kind of information Medicaid already has for these populations so that we can better understand what their needs are. And I think we decided to kind of take a step back and look at that data before we went further with additional recommendations. Who from Medicaid is going to be able to present that data to us?
Emily, this is a new business item, correct?
Yes.
So we could try to get that data to you for the next meeting.
Oh, okay. Yeah. I understood that it would be something we would discuss today, but I think for the sake of time, it probably makes sense for us to do it at the next meeting. And then the dental services request. This is something that, I submitted this request a few months ago. We've gone back and forth to kind of clarify the request. I just put it all there so that it would be a little easier for everyone to see what was submitted via email. And I had a quick conversation with Commissioner Lee last week, and it sounded like there was some work being done to try to pull this data. Is there any update there?
No, we have submitted the request for the data, but we don't have it back yet.
Okay. All right. Thanks, Kelly. And I'm sorry. It sounds like you've got a hoarse voice. I don't want to make you talk too much.
I've had a hoarse voice since June, so it's fine.
Oh. All right. So we're waiting on that. If we can go to the next page, I'm pretty sure that was the last item aside from recommendations. Well, general discussion. Is there anything else that people want to bring to the conversation today?
Well, before you get to that, I might have some of the language access data. Let me,
Okay.
I have a report. Let me pull that up and see if this is what you're looking for. Let me get it up here first. This may not be exactly right. Okay. I believe, and I'm gonna have to out because I remember looking into something like this, and I'm gonna have to, and I found the email, but now I gotta find out what I asked for. This is okay. So this is how people respond on the application. Here are the questions that are asked, and this is the responses.
So are these applications, is it 265,000 because that's like the number of applications that were received in the past year? What's the time frame for that? Oh, I see it now, 7/1/2023 to 6 30. Okay. So for 1 year, that's how many people newly applied to Medicaid?
That would have, that we pulled this information as far as the accommodation, yes.
For new applications within that year, there were 266 maybe new applications, and then 938 requested accommodations. Okay. All right, that's helpful. Thank
Is
you.
this something what you were?
Yeah, I think this is really helpful. I would like to see this for the entire 1.4 million people who have Medicaid, but I do think that this, looking at the breakdown of what the kind of accommodation they need, is really helpful to see. What do other people think?
Yeah, agreed. And where it says interpreter needed, that's any kind of interpreter, sign language or verbal oral languages.
That's my assumption, being that's what's listed on the application. I'm not sure if it delves down to the specific. Hi. Or language.
I think
Look
the
at,
graph is a very good visual,
Yeah.
makes it easy to see.
Would this be something that plain language would that be an appropriate thing to include in this list?
I think it would be adding it, I think, to the application probably if a question, I would assume. Angie, is that right? Do you collect other sorts of information on the application related to communications or plain language?
I don't know. I'll be honest, I'm not an application expert. But we can certainly look into that, see what all that has. From what I gathered from the report that I got, these are all of the selections that they can do. So my assumption would be that plain language is not one of those options.
Yeah, that would be my assumption too. There may be some other way of looking at that, but I think everyone needs plain language, to be honest. Kind of think of it as a universal
Me
precaution.
included. Yeah, agree.
Yeah, but any maybe preferred communication modes of communication. I think that maybe there are questions related to like, paper mail versus text or phone. But I haven't looked at the application in a long time, I'll be honest. Well, thank you. Thank you, Angie, for sharing that data. And if you could pull it for the entire Medicaid population, everyone who's currently enrolled in Medicaid, I think that would be really helpful to see. It looks like it's a relatively small number of people who request those accommodations. And, I guess in some ways that's good to see. I wonder if everybody, is looking closely at the application or understanding it whenever they're filling it out. But hopefully those individuals are also then getting the services that they need. Is that once you get that sort of accommodation request in the application, what happens with that information? Is there any special outreach to those individuals?
That's another question I do not have the answer.
Okay. Well, maybe that can be another follow-up.
I believe, and yes, that would be a good follow-up. And I hate to assume things, but I'm thinking that this type of information, and if they're in an MCO, would be transferred over for that member so that they are aware of issues, language or access issues.
yeah, you know, for people with waivers, any case management.
Mm-hmm. Yeah,
I would
I'm sure.
hope.
I mean,
And-
this is somewhere in the system, the
Yeah, okay.
eligibility system. Who all uses it?
Well, and that might be a
that would
recommendation we
be
want to make in the
invaluable.
future if we realize that nobody, you know, that there isn't really a next step, that the information isn't always getting shared with the right person. We could potentially look at making a recommendation there. Any other questions or thoughts right now related to that data? I think we're going to skip over general discussion, just looking at the time. And I'm not sure that there's anything else that people necessarily want to bring up here. We don't usually have any additional items. As far as recommendations go, what are folks' thoughts on making recommendations today for the back? Right there, it looks like you've got something to say.
He thinks
we
we
are right.
he thinks we ought to wait
We have
because
we have done
because we don't know
what we have done
because we don't know what we're talking about.
right now.
My worry about I feel that way often, Arthur. My worry about waiting is that legislation is have to be put forward this legislative session and, you know, approved in order for the back to start in July. And so I don't know, you know, our next meeting is February.
Yeah.
And I think it's too late for us to wait until February. So if people aren't comfortable making recommendations, I would then just say, I would very strongly encourage everyone fill out that survey and include your thoughts in that survey. And just also remember that our recommendation is really just that, you know, there's no requirement on Medicaid side to accept it, to follow it. We are just making recommendations. So normally I like this process of, you know, making sure we're being thoughtful and getting all the information and being pretty certain that we've got the right recommendation to put forward. I feel a little bit more pressed for time today. Just because of that.
Say that one. What will we? What would we?
Or what do we recommend?
If we did. Yeah, what would we recommend if we did?
I mean, I could come up with a number of recommendations. The one that I think is kind of most crucial would be that we recommend that the new beneficiary advisor council include the current organizations that nominate the consumer TAC members, as well as additional seats for other Medicaid beneficiaries, family members, and caregivers. But that we at least, you know, are incorporating the consumer TAC as it is today into the beneficiary advisor council. It wouldn't mean that all the same people, the, you know, 5 of us, are necessarily going to serve on the back, but that the organizations that are nominating someone would be continuing that process in the future. And maybe that's not necessary. You know, I think it's something we have to discuss and I think decide on.
What would be the downside of recommending the consumer advisory be members of the back?
He said, say, can you say that again?
What would be if there was a recommendation? I don't know if that's the right term, Emily, but if the the membership of the Consumer Advisory Council, representing the different agencies and organizations that we represent, if we were put forward as I don't know if it's nominees or recommendation memberships to the back, would that be a bad thing? I keep thinking that would be a good thing.
If
Miranda, were you about to say something?
I was just gonna say, if the back has to be Medicaid members, family members, and caregivers, then some of us, like myself, wouldn't qualify.
Right. That's right. But the organization that has nominated you to serve
Yeah.
would
Yeah.
continue to be able to nominate another individual. Arthur, being a waiver recipient, you would qualify, but it would ultimately be up to PNA to determine whether to nominate you for that term and of course, once you serve a term, because of the back rules, you can't have a consecutive second term, so you would then roll off and another person would be nominated.
Yeah.
Even if even if we ain't on the back,
Yeah. Yeah.
we are still on TAC.
The consumer TAC would no longer exist in that
Yeah.
He said if he ain't wrong,
Yeah.
TAC
Yeah.
is
Yeah.
still TAC is still on going to be around.
It's possible. I think with the restructuring that DMS is doing, their hope is that there wouldn't be a consumer TAC at the same time as the Beneficiary Advisory Council because there's so much overlap.
But if we but if we recommend that but if we recommend that Mac do if we recommend a Mac do away with TAC and only have
The back.
B SUB what? Coming is B C O subcommission. Oh, and only have subcommission on committee. Then the TAC will and then TAC will go away.
Right. The TAC could go away. That's right.
I feel like the purpose of the back being to more deeply integrate the of consumers into the structure of how Medicaid is run makes a lot of sense and could make a a committee such as the consumer TAC exists right now, just less necessary if it's more integrated into the full back.
That's the conclusion that I've come to, Miranda, for myself. I thought for a while, maybe there would be some relationship between our committees. We could provide some sort of support or technical assistance, but I don't think so. I think that we're essentially like the Beneficiary Advisory Council is expanding upon what the consumer TAC is supposed to be now. And really maybe doing it better, you know, and really focusing more on that lived experience than what is in statute for the consumer TAC as it is. And having that, you know, automatic required representation on the MAC. So I think there are a lot of benefits to the Beneficiary Advisory Council. I think it's a new and improved consumer TAC in a way, if you want to think about it like that, right? It's like just better than what we have now. But I think there's also some benefit in having, you know, the experience that we have, the sort of the track record, or, you know, just sort of the fact that the consumer TAC has been around for a while and not losing all of that in this transition to a back. That was kind of my thinking behind having the same organizations be part of the back. That more kind of the institutional, that doesn't really sound quite right to me, but that institutional sort of knowledge that we have, that a new back with all new members want to have.
Right. No, I agree with the idea of including the current organizations that nominate the current consumer TAC members, kind of wrapping that up into how some of the seats of the back are decided.
Right.
That makes sense to me, and as well as having additional seats.
Yeah. And I do wish that we had more time for this. I'm sorry that we're kind of we're pressed for time today because our meeting ends at 3:30, but also because we know the legislation is going to be happening quickly. I really don't think we have until February to decide. I'll put this recommendation forward. You know, absolutely. If people don't feel ready for it, you want to vote no or you want to pass. I completely understand that. But hopefully we can continue the conversation. I just think this is kind of an essential piece that we need to at least have a recommendation around before this meeting ends. So what I would recommend is that the current consumer TAC membership, I'll say that the current consumer TAC organizational membership be included as part of the Beneficiary Advisory Council, in addition to other seats that are filled through a public application and nomination process.
But
but some of TAC members don't get Medicaid.
Right. It would be the organizations, Arthur, not the individuals who you see today. Not necessarily myself, yourself, Miranda. It would be the organizations that would be nominating someone.
You ain't gonna say nothing if nothing else. Because right now we don't know if if they're gonna do away with TAC or TAC will become a subcommittee of MAC. We don't know. We don't know that.
Okay.
Say, you're gonna what? You gonna shut up because you don't know because you don't know what you're talking about.
I think I understand what your concern is, Arthur. What I understand is the kind of options on the table is the consumer tech is probably going away. We could have the organizations as part of the back, or we could just let the back develop totally independently. And we can, of course, all individually provide recommendations through the survey. So those are the options that I see on the table. You know, we can make this recommendation and it could happen with or without our recommendation, because DMS could choose to include our nominating organizations on the back, with or without us. But that's why I was putting forward that recommendation. The other two options are to let the back just independently develop through that public nomination application process or whatever criteria the commissioner decides to use to select members. And then, of course, we can all make our own recommendations. So is everybody more comfortable just moving forward with that plan to individually make recommendations? Or would we like to vote on this?
I suggest we vote on your recommendation.
Okay. I don't think I can completely repeat it word for word. It is in the transcript, but
Emily, I wrote it down.
Thank you, Kelly.
You're welcome. I'll read it. Okay, the recommendation is that the current consumer rights client need TAC organization membership be included as part of the back in addition to other seats that are included through the public nomination process.
Yes, that's great. Thank you.
You're welcome.
So I'll ask for a motion to approve that recommendation.
I make a motion to approve that.
Thank you, Brenda. Second?
Second.
Ms. Miranda, all in favor say aye.
Aye.
Any opposed or pass? Pass, Arthur? Okay. I believe that the motion will still carry based on the number of people who voted yes, but thank you, Arthur. And again, I think we need to continue the conversation, and this is just a recommendation. I encourage everyone to take that survey and put all your thoughts down. And if you have the time tomorrow to tune in to the forum as well. And we'll continue to give this some thought. But for the legislation, that's really what I wanted to make sure we discussed. Does anybody want to put forward another recommendation? I know that literacy was something that came up last time that could also be included in what we do individually. I don't know what people's schedules are, if we need to have a hard stop at 3:30. I do have another meeting that I'm supposed to jump to, but I can be a few minutes late.
Yeah, I just wrote down from last time that the recommendation that in planning for full diversity of Medicaid members on the back that DMS considered literacy in the materials. So
let's, I'll have you put that forward as a recommendation, Miranda, and I'll ask for a motion. I'll make a motion because I didn't put it forward. A second.
I second it.
Thank you, Brenda. And all in favor say aye. Aye.
Aye.
Any opposed? Or pass? All right. That recommendation, motion carries. And so we'll have two recommendations to put forward to for the next MAC meeting. I will be the representative there. I'll give that report. And you can see our 2025 meeting schedule here that we all agreed to via email. That could change, assuming that, you know, the back starts in January, or in July, excuse me. It may be that we don't have some of those later meetings, or maybe there's some overlap for some amount of time. Any other questions or anything else that people want to raise before we adjourn?
Yeah,
Yeah.
gonna ask something. Can we call? Can we call for a meeting if we need extra meeting?
Yes, we technically can. January is going to be a little busy for me. I'm going to be out of the country for a couple of weeks. And our next meeting would be, what is it, February 18th. So we can potentially do that if it's early in January. And if everyone agrees that you want to do that, we can send around an email and look for a time that we can schedule.
Yeah.
Of course, it'll also depend on DMS's availability, but okay. Arthur, we can try to do that and hopefully make this short. Would this be specific to just the back?
Yeah.
Yeah, so a shorter meeting. Okay. Yep.
I like that idea.
Okay, great. Well, then we will look to schedule something in early January. So hopefully everybody's still a little bit flexible then. Hasn't put too many meetings on your calendars just yet.
Emily, I'll try to send you some available dates and times tomorrow.
Oh, wonderful. Thanks, Kelly. That'd be perfect. All right. Well, thank you everybody for your time and for hanging in there with us. I appreciate the conversation today. Give it some thought, attend that forum, and then, yeah, we can have another conversation again in January. All right. Have a good one, everyone. We'll adjourn by acclamation. Bye.
Bye.
Bye. Happy holidays.
Happy holidays to everyone.
Thanks, everyone.